Good morning. My topic is unusual presentation of lobular capillary hemangioma on the eyelid. A lobular capillary hemangioma is considered a benign vascular tumor of the skin. Capillary hemangiomas can be seen as an abnormal proliferation of a normal tissue in location which commonly seen in boys. It presents as a red to purple, flat to raised, most commonly seen in the upper eyelid. The purely intradermal lesions are bright red in appearance and refer to as strawberry nevus. They blanch on pressure and may increase in size on crying. Capillary hemangiomas are without pulsation and have no bruit. So a case report, a 9-year-old female patient from Gurdaspur, Punjab presented in IOPD with right upper eyelid mass which patient felt on rubbing her eyelid 15 days back. Mass was red in color, non-mobile, was formed to touch and gradually increase in size over time. It was not associated with pain, redness and tenderness, no history of any ocular trauma, no prior medical or surgical treatment history. On ocular examination, left eye is within normal limits with best corrected visual acuity of 6/6. In right eye, on eyelid, a red well-defined lobular mass measuring 1 into 0.5 into 0.5 centimeter in diameter were present on upper eyelid margin. Mass was formed to touch, non-tender, non-reducible, no local rise in temperature, no abnormal vessels observed, transillumination test negative, fluctuation test negative, no signs of inflammation or no mechanical ptosis present. Rest of the anterior segment is normal with normal fundus examination. Diagnosis, the provisional diagnosis was made a single capillary hemangioma based on its presentation and decided that an excisional biopsy would be required to determine the nature of mass and rule out other benign or malignant lesions. So the patient underwent surgical excision of mass under local anesthesia and biopsy was obtained in the same setting and sent for histopath. The wound was closed using 60 vicral sutures. Intra and post-op period was uneventful. On histopath report showed globular, partly skin covered, grey white to grey brown soft tissue piece measuring 1 into 0.8 into 0.8 centimeter. Features are those for lobular capillary hemangioma. So in this patient was followed up on day 5 and day 15 where the wound has healed and no signs of leakage, infection or redness or swelling seen. Sutures were safely removed on post-op day 15 with excellent osmosis. Hemangiomas are described histologically as capillary cavernous, mixed or sclerosing. Capillary hemangiomas is one of the most common benign orbital tumors of the childhood, affecting up to 5% of the infants under 1 year of age. Capillary hemangioma itself has a nomenclature of its own: infantile, juvenile, benign or hypertrophic. It could be a sequelae metastatic. The histological type of hemangioma is more commonly congenital than it's required, which made this case quite intriguing as there are only a handful number of cases. The differential diagnosis could include benign lesions such as cavernous hemangioma, lymphangiomas, orbital cyst, vascular ectasis and bacillary angiomatosis. It may also include more malignant lesions like Kaposi sarcoma, rhabdomyosarcoma or metastatic. The diagnosis is often made clinically with exclusion of differentials with ACE of histopath. However, imaging may be necessary in diagnosis of large tumors to note its vascularity and extension. Most effective treatment till date would be a surgical excision, especially in the patients who fail to respond to alternative, which may include beta blockers, radiotherapy, diathermy, intralesional bleomycin or corticosteroids. A commonly discussed treatment modality was the use of beta blockers, namely propranolol, due to its vasoconstrictive role. So lobular capillary hemangiomas commonly present during childhood and are most common benign tumors in that age group. Diagnosis is made radiographical imaging, clinically or radiographic imaging may be used. Though in most cases the management remains conservative, it may resolve spontaneously. A number of cases have been managed surgically for cosmetic lesions and to prevent further complications like amblyopia or astigmatism where the lesion is bigger. Surgical interventions may be opted. So therefore each patient must be managed according to their individual presentation and conditions in order to effectively treat a capillary hemangioma with minimal complications.
So, why didn't you use any drugs? Like you have said that there is role of some drugs also for such cases.
Actually, patient, the child, she's child, and their parents wanted ki like we have to remove it, matlab without any testing drugs.
So are there any cases where you would want to go in with the drug therapy or conservative management before going in for surgical?
Ma'am, if the lesion is large, then we have to excise it for to decrease the complications like astigmatism or amblyopia for further. But if the lesion is small and the patient is compliant, we can go for intralesional bleomycin or corticosteroids injection in those cases.
Any systemic causes? This was a single lesion you found. It was a child. So giving, starting initially was excision indicated, or you could have gone for propranolol in these cases. Child is there. Or, and in which cases you have this lobular, you are telling capillary hemangiomas, any systemic causes should be evaluated? Or we keep it as idiopathic and just treat the child of eye only?
Ma'am, capillary hemangiomas can be present on mucosa, like mainly because
You had a single one, so if a recurrence comes and something, so should we treat them initially this way or should we do a systemic examination? That's my only question.
ma'am, we have to do systemic examination also.
Okay.